This is Jimmy Hernandez. This is 113 co-occurring disorders. It's November 17th, 2024. This is building a treatment plan for alcohol and tobacco use disorders. My client is 45 years old, states that he has been drinking heavily for 10 years and wants to quit both alcohol and tobacco. The client claims that he is having withdrawal symptoms, including anxiety, tremors, and wants help with both their alcohol and tobacco use. I will start by letting the client know that anything said between us will be kept confidential unless he says otherwise. I would also let them know that I have the responsibility of the duty to warn that any mention of hurting themselves or others, that I would have to report what had been mentioned to my supervisor. Okay. During my assessment, I would be trying to differentiate the alcohol AUD is the only issue the client is dealing with besides smoking cigarettes, anxiety, and tremors, or is the drinking caused by underlying psychiatric disorders or even a medical one. Symptoms of a mental disorder can be mimicked by substances. For example, hallucinations may produce symptoms that resemble psychosis, and depression commonly occur during withdrawals from many substances. Even with well-tested tools, distinguishing between mental disorders and substance-related disorders can be difficult without additional information such as the history, chronology of symptoms. In this case, I will first start addressing the alcohol issue, then move on to the smoking issue later. I will ask the client to let me know, in his own words, when did he start drinking and the reason why he believes he started drinking. I also would ask the client what is the reason he continues to drink alcohol until this very day, and a series of structured questions. The tool that I would use in this case would be the Mental Health Screening Form 3 to determine if there are any underlying psychiatric disorders or mental issues. I will continually reassess the client and will deal with the anxiety issues after the client has gotten past the withdrawal stage. The other tool that I would use would be the Clinical Institute Withdrawal of Alcohol Revised. The client will be going through different stages of withdrawal that need to be carefully monitored. This test involves a score system. For every question you ask the client, it will keep a score. The score will depend on how the client answers the questions. At the end, you total the questions. The higher the score, the more severe the withdrawal symptoms. A first stage will start at 6 to 12 hours after their last drink, with mild symptoms such as anxiety, insomnia, and nausea. Second stage will occur 12 to 48 hours after the last drink, with moderate symptoms like increased heart rate, high blood pressure, and mild confusion. The third stage occurs 48 to 72 hours after the last drink. Severe symptoms like hallucinations, seizures, and delirium tremens, DTs, may occur. The fourth stage occurs 2 to 5 days after the last drink. Symptoms may include confusion, agitation, fever, rapid heartbeat, high blood pressure, sweating, delirium tremens. I would use this tool so I can keep an eye on what stage my client is in at the specific moment to better assist him and help him with any kind of medications available, if any, that would help ease the withdrawals. At the same time, monitoring the client's vitals such as blood pressure and temperature and help keep them in a stable condition. The treatment plan for my client would be to place the client in an integrated medically managed facility for 14 days, which I will be able to provide medical withdrawal management, as well as biomedical and psychiatric comorbidities in the main continuum of care. As per the ASAM criteria, I would place the client at a level 4 medical managed inpatient. The client will be going through withdrawal that needs to be carefully monitored due to the delirium tremens DTs. Delirium tremens DTs is a medical emergency that can cause a wide range of side effects, including severe symptoms such as hallucinations, seizures, disorientation, and delirium tremens. Other side effects: elevated heart rate and blood pressure, fever, delusions, agitation, irritability. After the 14 days, I would place the client in level 1, 1.0 long-term remission monitoring for 90 days. This level of care will provide long-term remission monitoring for the client that will be in sustained remission, providing recovery management checkups and rapid re-engagement in care when needed. At the same time, I would encourage the client to participate in behavioral therapies such as motivational enhancement therapies and a 12-step program to help him in his recovery AUD, as well as to help deal with the client's anxiety. I would schedule an appointment to see the client every 2 weeks for a period of 6 months to monitor the process of his detoxification. Okay. The client is also wanting to stop smoking. The tool I would use for treatment is cognitive behavioral therapy, CBT, and psychoeducational classes that will help increase the client's awareness of their specific problems and do so in a safe and positive context. These classes are designed to help clients become aware of cues or triggers that make them more likely to abuse substances and help them develop alternative coping responses to those cues. Providers suggest the use of mood logs. By using these logs would help the client answer the question, when they have an urge to drink or smoke, what is happening? Patients also get training on recognizing cues for the return of psychiatric symptoms and for affect and emotion management, including how to identify, contain, and express feelings appropriately. I think this too would really benefit the client and give him an inside view of what is taking place within him and take the necessary steps for change. I would recommend nicotine chewing gum or patches to help with the urges of smoking. To find something else to do with his hands, whether when the urges show up, such as holding a pencil or a pen in their hands, or even eating a piece of candy instead of smoking. I would make it a point to meet with the client once a week to see if he is abstaining from tobacco use. And that is the end. Thank you.